All right, here we are at the last module. We're going to talk about assessments and just knowing the timing of our coursework. It is entirely possible you have just taken the assessment course, which is also by me. So this may be fresh in your minds. And then, the last set of ethics codes are about therapy. Since you're not getting trained to do therapy, I've really taken this as when do you refer for therapy? Well, hello. Do you want to refer people to therapy? Come here. They haven't seen you yet. So this is my cat Simba. He likes to make what I call cameos instead of cameos in my videos. So I'm kind of surprised he hasn't, Zoom bombed us yet. He is about to be 10 and he's a very good boy. We'll put you down, okay? All right. So that is Simba. So Section 9 of the Ethics Code looks at assessment. So we need to think about the bases for our assessment. Why are we doing an assessment? What is the purpose of it? Is it going to actually give us information that we need? And then we need to think about how are we going to use the assessment? We need to think about how we pick which assessments we're going to give. We need to think about, are those up to date? And then we need to think about, what are the results going to tell us and how is that going to impact this person's life? Again, not shockingly, there's a whole section about informed consent. Yes, do it. Get informed consent. Release test data. No, don't do it. Typically, we tend to think of test data as the actual raw scores that people receive. And we often instead report total scores, and we put those in context for the person, right? Because the person isn't going to necessarily know what 100 on an intelligence test means, right? Or a 7 on one of the subscales, right? But we can put the overall score of 100 in the context. That means average. That's good, right? Test construction. So if you're making a test, you need to think about all the psychometrics. You need to be engaging in good validity. We need to be making sure it's reliable. We need to be thinking about test retest, how the items work together, things along those lines. Interpreting assessment results, we should not go beyond the scope of what is interpretable. When I was coming up through grad school, we were just sort of getting rid of an idea that your scores on an intelligence test could also tell you something about your personality. I'm very glad we got rid of that. We have good personality assessments. We don't need that. Assessments shouldn't be done by unqualified people, the exception being if you're training someone and giving them supervision in the assessment. And don't use obsolete tests, right? So I believe we're up to the 5th version of both the child and the adult intelligence scales under the Wechsler system. It would be very unethical to go back and give the 3rd edition. It's not normed for people now. It's out of date. It's not going to give you accurate information. And in fact, may you give you inaccurate information that could be harmful. Also, let's say someone was tested 15 years ago when they were 5 and now they're 20. We're not going to use the outdated test results, right? We're going to get fresh ones. There are test scoring and interpretation services. So for example, if you use one of the most common personality assessments, the MMPI, you can pay them to score it and give you an interpretation. Saves a lot of time, costs a decent amount of money, but it's worth it if you're doing a lot of them, right? So companies like that have really careful security in place and are very loyal to the test interpretation. Just make sure you're not using someone who doesn't know what they're doing, basically, right? And then explaining assessment results is so important. You want to sit down with the person, have a session where you explain what these mean and what the next steps are, things along those lines. And then maintaining test security. We don't want to be like, woo, here's this test that you actually have to pay $2,000 for. I'm just going to stick it on the internet. Not good. Not only because of like copyrighted legal issues, right? But if test items get out, it can invalidate the test because people are not seeing them for the first time when they come into BSM. So I really like this Patterson and use article, even though it's a little older, but I love that we're looking at like a South African sample and thinking about what's happening in other countries besides the US. And so they were talking about like, when are you using assessments? And so you'll see they did some qualitative things here. So a key theme was context background of test use in the workplace. So they're talking about the advantages of using those tests, combining it with other methods, the purposes they're doing it. They're talking about legislation changes, guidelines in their area, the influence of the changing world of work, right? Cross-cultural use of tests. In South Africa, for example, I don't know how many languages are spoken, but it's probably 20 or more, right? So if someone comes in and their native tongue is, not English, right? Which dialect are they speaking and can they understand the test? Norming and renorming of tests, adaptation of existing tests, development of new tests, and then training and competence of test users. So that becomes really important. So how are they using the tests? They said for selection and recruitment. Yeah, we talked a lot about that in the assessment course. Training and development, team development, interpersonal skills and self-improvement, career counseling and development. Some of you may have worked with our career and internship department on our campus, and succession planning. Other things that were brought up is like identification of potential, doing research, and screening large numbers of people. And then there were some that came up occasionally, but not that often, like optimal fit and placement, retention, determining literacy levels, accreditation of qualifications, promotion, identifying behavioral issues, job analysis, development of leadership, evaluation, and training of users. Section 10 of the Ethics Code does apply to therapy. So, shocking. Informed consent is one of the things here. In therapy involving couples or families, it's really important that you identify who is your patient. It's typically the relationship between the couple among the members of the family, right? And like avoiding dual roles here. So you should not be the family therapist and one of the members of the family's individual therapist, because then it's like, who is your client? Group therapy, making sure everyone in the group knows like, this is confidential, don't go blabbing things outside of it. Providing therapy to those served by others. So let's say there's someone who's in individual therapy or is seeing a psychiatrist for their medications, and they want to come to you for your group therapy. Is that compatible? Here's a really good time to get releases of information so you can talk to those other mental health professionals and make sure you aren't giving contradictory messages. Now we're going to go to our yes, no's. Sexual intimacies with current therapy clients, patients, no. Sexual intimacies with relatives or significant others of current therapy clients, patients, no. And I love there's a line in here, I'm going to have to paraphrase it because I didn't quote it, but it's like, and you can't terminate therapy to do this. Like, you can't be like, client, I'm done with you so I can sleep with your mom. Oh my gosh, no. Therapy with former sexual partners, no. This next one always bothers me. Sexual intimacies with former therapy clients and patients, no, but only for 2 years, and then somehow it's magically okay. If I wrote the ethics code, it'd be no for life. Like, you do not need to have sex with someone you've done therapy with, right? And they do have guidelines, and basically, like, you have to show that this is not contraindicated And basically you have to show that you weren't like, well, okay, we're going to end therapy and then in 2 years we can hook up, right? And I just think, why? Why? There are 7 billion people plus in the world. Just find somebody else, right? Again, Dr. Meyer's editorializing. Interruption of therapy. I'll give you an example. When I was on my internship year, there was a psychiatrist who was diagnosed with cancer. And so she had to transfer her client. And I got a client who had already really like bonded with her, and I had a lot of resistance, understandably. She's like, I don't want to tell my story again. And I'm like, it helps me to hear it from you, right? And so we butted heads for, I don't know, 5 sessions or so, but then she became one of the clients that like worked best with me. But you need to set that up well, right? And then terminating therapy. It's a weird way of saying ending therapy, right? You're not terminating in the Terminator, I'll be back type of way. But you need to make sure you like set the client up if they need a transfer to somebody else, or even if you're just like, you are ready to end therapy, you need to make sure they understand that they can keep applying the skills that you've taught them. So the Blackboard readings I thought were really interesting here. So the B and TSAR one, it's written for healthcare workers, but I think it really applies to other fields. So you want to refer people when there's inadequate time or you have inadequate training to address mental health issues. Refer them if they have any sort of complex or high risk mental health issue. And if the person says, hey, I feel like I'd really benefit from talking to a mental health specialist, refer them. And they have some really nice case study examples describing different types of therapies. I'm going to guess at this poor person's last name, Barcusen, maybe, from 2015. This is another South African article. There's lots of really interesting South African articles in this area. But they were like, should industrial organizational psychologists act as counselors? And one of the things that they ask is like, does the curriculum properly address counseling skills? And so I looked this up for the US, and if you go to the slides that are posted on Blackboard, you'll be able to click this link about recommendations. This is Division 14 of the American Psychological Association, the Society for Industrial and Organizational Psychology. They have a whole bunch of recommendations for IO programs. None of them are about counseling. So in America, it's not an expectation. And basically what the authors here argue is that there should be more skills training if they are expecting someone to do counseling. And then this is the last chapter of your blue book, the Hatcher book, and it's like giving psychology ethics away, and they look at how it applies. In particular, they use a case study of the COVID-19 pandemic and some of these key features, right? So informed consent, right? Contact tracing. They just like gave your info to the contact tracers, right? We understand why for public health issues, but feels a little weird in normal medical context, right? And then as we start to get back to things opening, they would like take your temperature when you went into, I think I went to like the optometrist and they took it, right? I mean, that makes sense. You're going to be breathing on them while they're checking your eyes, but you didn't necessarily consent to that. Privacy and confidentiality. They give an example of a super spreader who was just like put on blast in the media. And then telehealth. I talked to some grad students during the pandemic, and they were like, we got no training in telehealth. And then all of a sudden, all of our therapy was on telehealth. And then, like, are they using a HIPAA compliant Zoom related system? Conflicts of interest, when to open up, stay at home, protect people, open up, protect the economy, right? Recommendations or people were using might have been conflicting politics. Is it benefiting me? Is it benefiting my constituents? Is it benefiting the country as a whole? exploitative in multiple relationships. The essential workers, not only healthcare workers, but grocery store workers, gas station workers, right? People on these lines. Often folks, if we add in like housekeeping roles in hospitals, often folks who are not making a ton of money, right? And were exploited and put on the front lines without PPE, and that included doctors. I have a friend who works in emergency medicine, and they would take their N95s and just like put them in a paper bag to dry and wear them again. That's not how you're supposed to do it, but they just didn't have more. And then the politics of everything. You're going to see politics pop up a lot here, right? There was harassment and discrimination, particularly of individuals of Asian descent, because they blamed China for this. Uh, there was harassment of medical personnel, and sometimes there still is over COVID. False and deceptive statements. People were saying UV light or ingesting bleach, or people are still on this ivermectin thing, which is a horse dewormer. It's not going to cure COVID. It's not going to cure cancer, right? Not ethical. Don't make shiz up, right? Boundaries of competence. Politicians trying to act as medical experts. And then we saw the boundaries of competence when parents had to homeschool or like assist their kids in virtual learning. Teachers are trained for a reason, y'all, right? Teachers know what they're doing. And then personal problems and conflicts. A lot of people got like social anxiety after being at home for so long. People who worked in the healthcare field got PTSD because they literally had to have like semi-trailer refrigerated trucks to keep the bodies in because the morgue couldn't keep up. I think the show The Pit does a really nice job of illustrating this with Dr. Robbie. And unfortunately, we saw an uptick in domestic violence because people were stuck at home with their abusers. And basically, people should work for the greater good, regardless of their ethical code. And again, that doesn't seem like that's rocket science, but to some people it is. Hopefully you've enjoyed this class. Hopefully it's been informative and helpful. I wish y'all the best.